Why do we need to use manual muscle testing to diagnose issues that patients come with? It's a complicated question. I will try to answer it in a simple way, and it's up to you to judge if I succeed. You see, any issue, especially pain syndrome, manifests under load. The patient will not feel pain at rest, but when they move, sit, stand, or walk around, they feel pain. So it makes sense to test their condition under load. And neurologists study reflexes using the hammer at rest, and we perform tests under the load that causes the pain syndrome. And this is how we identify hidden compression syndrome and biochemical and biomechanical issues and emotional issues. There are a lot of things we cannot diagnose when the patient is at rest. They may come to the physician's office and say, I used to feel pain all over and now I forgot where I felt pain at all. Because pain only occurs under load. To diagnose the patient, we need to perform challenge, but in order to understand what kind of challenge we need, we perform manual muscle testing. We perform isometric contraction of the muscle in order to increase its tone, and then we stretch it and check its reflexes. That's how we find hidden problems. That's why we need manual muscle testing. When you come with the pain syndrome, the neurologist checks your reflexes and sees that everything is perfectly fine, but that's at rest and we need to test you under load. It's important to check your reflexes when you sit and when you walk and when you stand, and only then can we find your hidden problems, the issues that we cannot diagnose when the patient is at rest.